Yeah, that can always be a little bit difficult to build trust with somebody you just met and for a diagnosis that is, for some of these patients, very much life-threatening. I think the first thing you need to do is make sure that you're comfortable with the process. Is the process streamlined? Are you having to chase everything down on your own? And is it just really, really hard and cumbersome, especially since you're juggling multiple things like your own diagnosis or your caregivers are trying to help that person during their journey with this brain tumor. I think it's really important that the process is streamlined. I trained at an excellence center that, I mean, just it was like a machine. They just knew what they were doing. They knew how to navigate patients from outside systems into their system. So I think it was a great example of meeting the needs of these patients as they're working to transition their care to subspecialists. I think another thing to consider is that communication is extremely important. I think it's key, making sure that you have always somebody to speak to, whether it's like a nurse or a nurse navigator. I think that the presence of nurse navigators at a subspecialty site is absolutely paramount to making all of this a success, to getting not only your records, but also managing your comfort and your anxieties with getting there on time and getting everything done and arranged. Nurse navigators are absolutely invaluable for that. And of course, when you're finally meeting the subspecialists, what are they like? Are they very engaged or do they seem a little detached? Are they very, very much into their research, yet not into the clinical aspect of the care for these patients? And it's not necessarily a dichotomy. You could be both. You could be both really engaged in science and at the same time be an incredibly humanistic individual. But it's sometimes hard to find those people. Not to say that people who are engaged in a lot of science aren't dedicated to changing the standard of care for brain tumor patients. It's just that, are you going to be comfortable with people like that? And I think that's what it comes down to sometimes. Maybe not even the trials, maybe not even the surgical expertise or whatever treatment you may get. It's just finding people that resonate with you, that you're comfortable with, and that you trust. That is, I think, one of the most important things you can do for yourself as a patient.